Hello, and thanks for joining us today on CareConnections, a three-part webcast series where we have real talk on rare conditions. CareConnect PSS represents Sanofi Genzyme's 35-year commitment to the rare disease community. We are so excited you could join us today. I'm your host, Pam, and I'm a CareConnect PSS Patient Education Liaison at Sanofi Genzyme. Last episode, we heard from two patients, Carrie and Andrea. They spoke about managing their condition with their day-to-day life, relationships, work, and personal interests. Today, we will focus on the care circle and caring for someone with a rare disease. We'll hear from Brian and Amy, who are the parents of Andrea, who we spoke to in our last episode. We'll also hear from David, the husband of Carrie, and their three children, Ellison, Fielding, and Grayson. As they explain their own story, we will learn more about the role of the care partner, the impact of the condition on the family, and how to give and receive support. So let's get started. To start things off, can each of you please introduce yourselves?
Hi, my name is Brian. I'm from Buffalo, New York. My daughter is Andrea, and I am a computer programmer.
I'm Amy. I'm Brian's wife, mother of Andrea. I'm a grandma, so I stay home and watch my grandsons during the day.
My name is David. I am from St. Louis, Missouri. I am Carrie's husband. I am a teacher, English teacher at a public high school in St. Louis. And I have three beautiful children.
So what impact did the diagnosis have on your family?
I was young when my wife got diagnosed. I was like 31 years old and we had just had our daughter. So it really didn't register, I don't think, with me, because what I was thinking was it's not cancer, so you're going to be fine. So it didn't take, it probably was another year, for at least for myself, to see the impact that it actually was going to have on our family. And I think when it really kind of hit me, because my wife didn't have any treatment while she was nursing. So it was a good, almost a year, I guess, after her diagnosis before she really kind of started treatment. And seeing her hooked up for the first time, that's where it kind of was like, this is my life now. But even tougher, this is her life. And that was probably the most difficult thing, was seeing that I am helpless and there's nothing I can do to make this go away.
What do you still have questions on now?
Am I going to be a single father, in 5 years, 10 years? And does everything that she gets going forward, is it because of this disease, and is it going to continue to progress? Is there a higher risk for cancer? Is there higher? We don't know. No one really knows. And I think that's what it comes down to, is there just aren't any answers. It's rare.
Yeah, it's kind of like our daughter. She's at the stage, she's in her early 30s and trying to decide whether to have children or not, and exploring what options are out there. And there's some things that she could do, but because of our faith, she's really reluctant to do some of it. So she's really struggling with it. She'd like to have children of her own, but she's just really, I think that's probably the biggest thing for her right now. I mean, the disease itself is there, and she can deal with the symptoms. It's the part of, she wants to have kids, and what do I do? Do I not have children of my own and adopt and stop the disease in its tracks there and not pass it on, or do I go through the experience of being pregnant and having a child and maybe 50-50 chance that she passes the disease on? So she really struggles with that part of it. So it's hard for her.
Who did you reach out to find support and information on being a care partner?
I think our genetic doctor in Buffalo really explained some, but Sanofi Genzyme really came in, and really the education there and the comfort of knowing there's somebody that I can ask what I consider dumb questions to and explain it to me, because it is confusing for me. I still don't understand all the aspects of it and all the health things that are going to happen down the road.
What was challenging about transitioning to the role of a care partner? Did it affect your relationship at all?
I think the hardest part, at least for myself, was we had a new baby, and I wanted to save her. And I still had in the back of my mind that she's going to be fine, she's going to be fine. This is all going to go away, basically. And so it didn't. And what I struggled with was listening initially, and just kind of just being a shoulder, because in reality, that's all I can be. And so that was probably the most difficult, was that acceptance of, this is going to happen, this is a reality, this is our life. And just learning how can I best assist my wife? How can I best assist Carrie to make her life easier and make this easier, for our kids, for everyone. And that's what I had to learn to do.
Well, as a mom and a wife, Andrea's an adult now, so as a caregiver, I can just be there for support if she wants to talk or say anything, but she's like, I'm fine. And with Brian, I watch a lot, because he doesn't say much, but I watch, and then I read, and I accept, because like you say, this is our life, this is our reality.
And that kind of ties into, how do you provide support for your loved ones?
Just, if they come to you, have an open mind. Don't be overbearing. Just be who I am. I'm not gonna walk around on eggshells around him. I'm still gonna, when he tells me he can't do something, or I see he can't do something, I just have to be accepting of that. And sometimes that's hard.
And what you were saying about not trying to fix it, that's really good for the person with the disease, for me anyway, probably your wife too, because it can't be fixed. And we understand that, and we understand that there's stuff that is going to happen in our lives that's going to be difficult. And really what we need is just someone to listen once in a while and just say, okay, if we get frustrated and get angry once in a while, and I try not to, but it happens. So it's just like, well, it's not because I'm mad or angry at somebody.
No.
It's I'm dealing with something that I can't stop, and that gets frustrating. So I think you're right in what you're saying, just sit back and listen once in a while, and it's okay to talk, but not not to the point where it's like, let me fix this thing, because I'm the way you are too. I want to fix stuff, and I can't. So it's the way it is.
And how do you help siblings and children, extended family, understand the condition and kind of what your family situation is?
So it's all my kids have known, which is weird to say. So our nurse my wife's nurse, that I guess she's had for about 2 years now. I mean, she's part of the family, to be quite honest, and she's actually cycling out to retire. And that's like, what do you do now? So Carrie's only done treatments at home. She's never gone to maybe her first 2. She went to to a care center or something like that, but everything else has been at home. So these nurses have become part of our lives. Mm-hmm. And it's hard. Originally, when it first kind of started, it was, she wanted to show the kids and this. And there's nothing wrong with that, obviously. That is the reality. Now more so, I tried to take them away for her and for them, just because our youngest is 5, and Grayson's great, but he's also 5. It impacts our oldest daughter probably the most, Ellison, because she sees mommy like this and she has questions and we don't have answers. And you don't really know what to do with that. But it is what it is. And so you do the best to kind of explain in layman's terms to kids that are this young. But there are no good answers, and there's no good way to kind of explain it except for mommy's going to be okay.
How do you, as caregivers, find support for yourselves?
I don't really ask for support. I think that's just how I was raised, and that's just who I am. Because the support I need, no one can give me the answer.
Right.
So the research is great, people are great, everyone's helpful, but no one can tell me what's the end game.
Right.
And that's that's all I want.
We're here with David and Carrie's 3 children. Can you tell me your names and your ages?
My name is Ellison and I am 9 years old.
My name is Fielding and I am 7 years old.
My name is Grayson and I am 5.5 years old.
So, what do you love about your mom?
That she's always giving me hugs and kisses, and she's always cuddling with me, and she's always playing with me.
And how about you, Fielding?
She always plays outside with me and sits outside.
And Grayson?
My mommy always lets me go to the pool with my brother and sisters, and she lives with me almost every day, and sometimes she reads me stories before I go to bed.
Oh, that's nice. Ellison, what do you know about your mom's health condition, and when did you first learn about it?
I first figured out when I was like 7, I think, when we went to Disney World. She didn't go on any of the rides, and I was asking her why she wasn't going on any of the rides with us. And then she told me that she had a disease, and then now we kind of all know that she can't really go on the rides, but we don't really know about it.
Okay. And how did that make you feel when you found out that she had this condition?
It kind of made me feel sad because she can't really do all the things we can do. And it also makes me feel like it's not fair because she just has to watch us and she just has to sit there and she doesn't get to have fun with us.
Sometimes it's not fair for Ellison because she has a chewed up peanut allergy and she can't eat like all stuff that we can eat. Basically desserts.
Okay. And what do you guys do to help your mom when she maybe not feeling so good?
We give her hugs and kisses and we snuggle with her.
So how do you guys help each other if mom's not feeling well?
We just be quiet for her, not be running around the house playing games. We just sit in, play in our rooms quietly or play with each other.
And what would you tell your friends or other kids in your school if they have a mom or dad that has a health condition? Is there anything you can tell them that might help them out?
I would tell my friend that maybe when her mom or dad didn't feel so good, she could just play with their brother or sister in a room or read a book or do something quietly.
I would say that my mom has the same thing as your mom.
And give lots of hugs and snuggles?
A big thanks to Brian, Amy, David, Ellison, Grayson, and Fielding for joining us today and being so open and honest about your stories. It has been so helpful to hear your experiences about being a care partner and providing support for your family, so thank you again. This episode concludes our 3-part webcast series. We hope you enjoyed them. Remember, whether your needs are large or small, your CareConnect PSS team is there to provide the support you need. To learn more about the range of support offerings and to contact your case manager, call 800-745-447 option 3 or visit www.careconnectpss.com.